Right. To get great hair transplant results, it takes several factors to be done consistently over a long period of time. And there's obviously the hair transplant itself, but even prior to that, there is the medication. Uh, I don't operate if patients don't stabilize the androgenetic alopecia process on medical treatment. We go through that in a 2-hour consultation prior to anything happening. And there's no pressure on the patient. The patient decides entirely by themselves if they are on board. And that's everybody's decision. I take the medication. I've taken it for 20 years. So, I won't expect anybody to do something that I don't do myself. But one other very important aspect is the derma roller. It's one of the adjunctive treatments that I advocate to maintain after surgery, or even in some situations where people don't have surgery, they just do the medication. So there's the medication, and then there is washing with the recommended shampoos, and then there is the derma roller. So the derma roller, we run through the scalp 20 times from front to back. And I say when your hair is wet, after you've washed it in the morning or whenever you wash your hair, and you comb it straight, you comb it backwards or you comb it forwards. So you go in straight lines from the front to the middle, where the ears are, and from where the ears are back into the crown. And you just do 20. I do 20 a day, every day, in that fashion, at least 3 times a week, I'd say. It releases growth factors, and the growth factors rejuvenate the scalp in pretty much the same way as what you rejuvenate your body when you do exercise. When you injure a muscle slightly, it releases growth factors, the muscle grows stronger, and we call it fitness. So this is how you take your scalp to the gym. And it's underestimated how well this works and how big a role it plays in a sustainable good result. And I always recommend this.